Thank you for having me. My name is Dr. Abdulrazak Ibrahim. Commonly in clinical spaces, one of the obstetric emergencies is ruptured ectopic pregnancies. Ectopic pregnancy are pregnancies that, put in a layman way, a pregnancy that occurs outside of the uterus. So what that means is when fertilization of the sperm and the ovary happens outside of the uterus. So the pregnancy get implanted, be it in the ovary, be it in the fallopian tube, be it in the abdominal cavity, be it in the cervix. So any pregnancy that occurs extrauterine is called ectopic pregnancy. One of the major causes of ectopic pregnancy that were found from practice is existing fallopian tube infection, which is commonly called pelvic inflammatory disease. This infection could be responsible for a scar within the fallopian tube. Also, one of the causes of ectopic pregnancy is a previous ectopic pregnancy. In a situation where you have had surgeries done in the pelvic area, that could predispose an individual to ectopic pregnancy. Another cause of ectopic pregnancy is sometimes when you have a congenital malformation of the fallopian tube. So this does not allow the transit of the fertilized ovum from the ovary down to the uterus for proper implantation. And one of the common risk factor for ectopic pregnancy is smoking. Though that might not be a common denominator in our environment, but in other climes where smoking is religiously done, so smoking could also be a major risk factor for ectopic pregnancy. Major symptoms of ectopic pregnancy, which I usually call the red flags, are vaginal bleeding, lower abdominal pain, in a situation where it is ruptured and this rupture is taking, it's not minimal. It could result into peritoneal irritation where patients could start vomiting, have severe abdominal pain, shoulder pain. Sometimes they could have pain at the back. Lower back pain too could also be one of the major symptoms you see when there's ruptured ectopic pregnancy. Before I talk about chances of conception after ectopic pregnancy, we should talk about the management of ectopic pregnancy. There are actually